Welcome to this special COVID-19 update for the Town of Plymouth. I'm Donna Rodriguez. I'll be your host for today. This forum is being brought to you live on PACTV, on Comcast Channel 15 and Verizon Channel 47. You can also watch this on PACTV's streaming channel by going to pactv.org/live. For questions during today's forum, please email plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today's participants include Dr. Mark Wilson, Dr. Barry Potvin, Dr. Christopher Campbell, and Mathew Muratori. Thank you, everybody, for being here with us today. And I'd like to start off, so much information has come through in the last few days. It can be overwhelming, but we want to break everything down so that people feel comfortable knowing how to take care of themselves and their families, and to see the positive things that are happening as we move forward, working through this Omicron surge to ensure everybody's health and safety. I'm going to start with Dr. Mark Wilson, who is an active professor emeritus at the University of Michigan School of Public Health, Department of Epidemiology. Mark, thank you so much for joining us again today. We appreciate your time.
Thank you very much, Donna. I would like to start with just a very brief summary of the news that most of us are now already familiar with. The Omicron variant now represents more than 90% of new infections in the United States and really dominates transmission throughout most of the world. And this is a sudden change that's really happened over the course of just a month or so. The upsurge in new infections is unlike anything we've seen since the beginning of the pandemic, really. Omicron is much more easily transmitted. It infects people of all ages and can infect even those of us who are vaccinated and boosted. So this new surge is now creating even more social and economic disruption, psychological stress, and enormous impact on our healthcare system. And we all hear and read about this every day from almost every news outlet, it seems. So rather than repeating this information, I'd like to share some thoughts about how we might also look at the glasses half full. COVID is not just gloom and doom, and there are some silver linings that we should keep in mind. First, even though the new Omicron variant is very highly transmissible, studies are showing that it is much less virulent than earlier strains of the virus. Symptomatic infections tend to be less severe, and many are actually asymptomatic. So this lower severity is especially true for people who have been vaccinated. In fact, a recent report suggested non-vaccinated people who are infected with Omicron have a 17 times greater risk of being hospitalized and a 20 times greater risk of dying. So even though Omicron generally produces less severe disease, it's still critical to get vaccinated and boosted. The good news is that safe and effective vaccines continue to be readily available to most people in economically developed countries. Getting vaccine to the poor countries of the world is a different matter. Secondly, an interesting way to think about being infected with Omicron is that you are likely to benefit, in a sense, by having your antibody protection further enhanced. And this means that it's less likely that future exposure will lead to another infection. In other words, getting infected now, especially if you've been vaccinated, actually lowers your risk of another COVID infection in the future and for a longer period of time. While vaccination produces the best protection, really, an infection can be thought of as adding to that protection for the future. Third, mask use and social distancing to reduce COVID transmission has actually had an added benefit of reducing many other respiratory diseases in both children and adults. Studies have shown that COVID-related non-pharmaceutical interventions such as masking, hand washing, and so forth have also reduced the incidence of chickenpox, mumps, measles, and the common cold. Indeed, hospitalizations for pneumonia, COPD, and asthma have also declined. In addition, many studies have reported fewer cases of influenza, where masking and social distancing were practiced. In general, COVID-related hygiene efforts have reduced COVID risk for sure, but also they've decreased the incidence of other respiratory diseases. So that's a side benefit that, again, is good news. Fourth, because Omicron is so highly contagious, the current surge in infection has placed a huge burden on our healthcare system, our schools, our businesses, and many other institutions. However, because of this high contagion, forecasts indicate that the US should see a peak in infection very soon, and then a rapid decline in new cases. Many epidemiologists now believe that most people in the US will become infected with the Omicron variant. But those of us who are vaccinated and boosted should experience mild or no symptoms. Indeed, with more and more people becoming vaccinated and exposed, we should begin to approach what we've called herd immunity. And that threshold may actually reduce transmission to a huge extent. In that case, new cases would remain at a very low level, and a level that's economically and socially tolerable. One plausible scenario is that COVID will become more or less like seasonal influenza. This would mean that it would occur primarily in the winter. Most people will have partial protective immunity. Few people will experience life-threatening symptoms, and we will want to be vaccinated regularly. However, because this is a global pandemic, poor countries that lack access to vaccine will have to be included in a global program. This is not a sure bet, but more and more information suggests that COVID will evolve into this kind of a disease. Finally, let me just say that despite the terrible impacts of the COVID pandemic, it has also provided us with new perspectives and understanding about many aspects of our lives. Interestingly, COVID-related social and economic changes have resulted in less air pollution, in fewer traffic accidents, for example. Novel approaches to economic and social issues have emerged. Many of us are now thinking more about others and not just about ourselves. We're more deeply considering who and what matters to us the most. So let's try to keep in mind these and many other positive and unexpected side effects of the pandemic. I hope that my sharing a different way of thinking about the pandemic might be useful to the viewers, and I'd be happy to answer any questions later on in the program. Thank you.
Mark, I'd like to thank you so much for that perspective, because especially at a point where so many people are feeling either exhaustion or anxiety, it's so helpful to be able to take a step back and kind of reset where we are as well. So thank you very much for all of that. And we definitely will have questions from our viewers, and I have some questions for you as well when we come back. But right now we'd like to move on to Dr. Barry Potvin, Barry, Professor Emeritus from Yeshiva University, Department of Biology, as well as the Chair of the Plymouth Board of Health. Barry, welcome. Thank you for being here with us again and being willing to share your knowledge and provide so much information to us. So tell us a little bit more about what's happening in Plymouth specifically, and we'll go from there.
Okay, yes, thanks for having me again. I'd like to again thank Mark for coming on. It's always a pleasure having him with us. And I can even add a couple of things to what he said before I start the rest of the presentation. Moderna and Pfizer are both now working on new vaccines that are more specific for Omicron. May not be ready until probably, in one case, next fall. But they're also trying to develop new vaccines that would protect against not only the COVID viruses and the variants, but simultaneously also offer protection against things like influenza. So that's hopeful. To get through this as expeditiously as I can, I need to share the screen. So I'm going to try to do that. Usually, this works pretty well, unless I try to do videos, which is more of a problem. So if you look at this chart, this is Town of Plymouth, and it shows the average daily cases per 100,000 population. Over time, you can see it started at January 21st. I had to cut it off before that because there was no more room on the chart. And it goes through January 6th, which is the latest data we have. This all comes from the weekly Department of Public Health website, and it's their weekly update. They put it out every Thursday in the evening. So what's kind of bothersome here is that you can see that we've been going through quite a large spike in cases. And most recently, it's taken even a steeper jump. But again, I'm going to finish this off by showing you some very promising sort of information too. A lot of people talk about transmission risk. This is the way in which the CDC calculates it. You can see the new case of 100,000 in the past 7 days. If it gets above 100, it's a high risk. If the percentage of positive COVID tests goes above 10, it's also high risk. So here's what we see currently. So this is again, as of January 6th. I'm just going to skip over the US and the Mass data. Down at the bottom, you see Plymouth County, and it's way up at 1,720.6. Remember, anything over 100 is considered high risk. Plymouth, according to the latest data that comes from the state and also from our public health nurse, is 1296.1, still very, very high. So if you want to know about what are we doing in terms of the percentage positives, you can see that Town of Plymouth is now at 22.61, whereas Plymouth County is 24.38% positives. Massachusetts is 22.72, and it went actually down after 3 days to 22.39. So the county and the town are pretty much on par with what's going on in the rest of the state. And I'll show you more about the vaccination shortly. This is also put out by the CDC, and it shows entire state of Massachusetts colored red, which means that we're all 14 counties of Massachusetts are still considered high risk for transmission. This is another sort of diagram or figure that's come out recently about where the hotspots for transmission and for infections are in the state. And you can see that the hotspots are designated in darker purple, and it includes most of Plymouth County, maybe all of Plymouth County. It also includes some sections up in Essex County and the North Shore and Springfield and even Nantucket. So this is something which is of concern, of course. In terms of the hospitalizations in Plymouth County, not just our hospital here, again, if you look at the hospital admissions, the daily percentage beds used and the number of ICU beds used, it's all shown quite a significant spike over the last 7 days or so. Here's the latest data that Matt managed to help us get from the local hospital. So this is just 2 days ago. They reported 140 inpatients and 120 licensed beds. That's partly, I assume, because at the moment some of the beds are in surge space. There's 58 COVID positives with 9 also suspected with COVID. The ICU is completely full. They established a surge space for the overflows, and that has a total of 15 patients in it, with 7 of those also COVID positive. And the most concerning thing for the operation of our local hospital is they now have 100 staff out on COVID quarantine, which has a major impact on their ability to provide services. This is our latest vaccination data. It was effective as of January 4th. You can see, if you glance at it, that for the 5 to 11 age group, we have in Plymouth 22% fully vaccinated, 30% with 1 or more dose. The numbers are a little concerningly low also for the 12 to 15-year age group, much better for the 16 to 19s. Again, kind of concerning for the 20 to 29s, the 30 to 39s, the 50 to 64s, and the oldest groups, the 65 to 74 and the 75 plus, are pretty much completely fully vaccinated with at least 95% coverage. This final set of columns over here just shows you what we're doing in terms of booster shots. Down at the very bottom, you see the totals for Plymouth, and that means that 69% of everyone in Plymouth is now fully vaccinated, and 78% is got 1 dose or more. And if I can see it myself, I believe it's 31% are actually boosted. So they've received booster shots. So is this good? Yes. Is it below the state average? Yes. In many cases, 15% or so below the state averages. So we could do better, but we're doing well with the vaccines. Concern about the 5 to 11 year age group. And if you look at what's going on with them, you notice that the lowest percentages of being vaccinated with 1 or more doses corresponds to the 6 towns you see on the right, and the percentage vaccinations are there. The highest percentages are over on the left, and Plymouth, East Bridgewater, and Rochester are all at 30%. The Massachusetts state average is 44. Models show that the Omicron cases may peak within 2 weeks. This is the good news. It was just in the Boston Globe this morning. And hospitalizations could surge for a bit longer. It probably is going to take about 2 weeks before the skyrocketing COVID case increases start to taper off and decline. And this is done with computer modeling by the University of Washington Institute for Health Metrics and Evaluation, and also the CDC. So here's what they showed this morning in the Globe. This shows you what's expected to happen. And this peak that you see here is expected to be reached somewhere around January 22nd, with 53,000 cases per day at its peak here in the state of Massachusetts. That's a lot, but it's hopefully going to come down as fast as it went up. This is the long-range outlook for the coronavirus cases, where you can look at the best case, the worst case, and the most likely scenarios. And it doesn't really change very much. What changes is just the total number of cases at the peak. This is the hospital resource plots. You can see it's the black line is for hospital beds being utilized. The blue line is for ICU beds being utilized. And they feel, based on the computer modeling, that we will reach the peak somewhere around the 29th of January. This is the coronavirus deaths and deaths per day. And again, you can see they've developed it with 4 different scenarios. Reported deaths, which you see here, and then going from this vertical line to the right is the predictions based on computer modeling. The blue line you don't see very easily here is most likely. If there's 80% mask use, it's this dotted green line. If there's something that's even worse, it's going to be the kind of red orangey line. And with boosters, it's going to be the dotted red line. So, and on Tuesday, there was new guidance issued about when you should get tested, all kinds of things coming out from the state and also from the CDC. I don't really have time to go through it in detail, but I would like to point out to you that this is the kits. We should be seeing some of these delivered to the schools and to the child care centers very, very soon, probably this week. More will be coming later. Some will be coming from the federal government. They should be able to be received in large supplies. I think the town has also ordered 7,500 of them to distribute here in Plymouth. So that's all I can share at the moment, but I'd like to make everyone aware that we do have a Board of Health meeting again at 4 p.m. today, and around 4:30 to 6, we'll be discussing a lot of additional information about the mask mandate, the efficacy of the different kinds of masks that are available, where are reliable sources you can get them. We'll also be talking about what's going on with local business staffing shortages, which is creating quite a big problem for our local businesses. So thank you for your time. I hope I didn't run over too much.
Oh, thank you so much, Barry. And for those who are watching today on Wednesday, January 12th, you can also go to packtv.org/watch to get more information about how you can watch today's Board of Health meeting. And if it's after the 12th, you can go there as well to watch replays of the show. It's very important information, and the Board of Health in Plymouth spends a lot of time in working with the community. So you'll hear a lot of very important information through that episode. Thank you again. And next up, we'd like to bring in Dr. Christopher Campbell, who is our superintendent for the Plymouth Public Schools. We'd love to hear a little more from you about, what's been happening. We know numbers have jumped, and they really seem to be paralleling with our community rises. But what's happening in the school systems? With 14 schools, you have so much and so many that you're dealing with on a daily basis.
We do. Good afternoon, Donna. Thanks for having me today. Certainly, I have a lot of information to share. And as you said, the COVID numbers are high, but I feel that we should be optimistic about many things, which I'll get into during my remarks. So, as you know, COVID cases, as you said, in our community, including many of our students and many of our staff, have risen significantly. As students and staff headed into our holiday recess last month, through the first 15 weeks of school this year, our district had 708 confirmed cases. 631 were our students and 77 staff. Last year, over the same period of time, we had 156 cases, about 112 students and 44 staff through the same period. So that's an increase of more than 400% through the end of the calendar year. So last Wednesday, after the holiday break, our district reported 129 staff members with newly confirmed cases since December 23rd, when we went on break. And that's approximately 9% of our district employees. At the same time, we reported 431 students with newly confirmed cases since the holiday recess began. And that's 5.8% of our student population. So that's a lot in a short period of time. So but keep in mind that these cases were all during the holiday recess. But although the case numbers are reaching record highs, from all accounts, the strand that we're experiencing in our schools appears to cause milder disease, very much aligned with what Dr. Wilson's opening remarks. We anticipated a large spike in cases during the holidays and developed a plan to support our classrooms if coverage became too great of a challenge for a particular school. So with the support of our teachers union, our plan was to temporarily move staff to another school if too many teachers were out sick in a particular school and substitutes couldn't be found. So even with the 129 new cases among staff on that Monday, that temporary transfer was not needed. The cases really seemed to spread across the schools pretty proportionately and were among all types of positions: teachers, maintenance staff, specialists, and administrators. So, but having said that, it's still all hands on deck with many of our administrators, our specialists, our paraeducators taking over classrooms as needed. But despite what we're experiencing as a community, I truly believe that schools are the best and safest places for students, not only for their physical health, but their emotional well-being as well. We have 2 years of evidence now that continues to show the transmission of COVID happens overwhelmingly at home or in social situations away from school. I had an opportunity to hear from Dr. Branch Elliman last week. Dr. Elliman is an infectious disease specialist at Israel Deaconess Medical Center, an associate professor of medicine at Harvard Medical School. She spoke at a Zoom call with superintendents. She spoke about the importance of why we need schools open. We know that remote learning, based on 2 years of research, is not the same as in-person instruction. We have certain subgroups of our student body that cannot access learning remotely due to their disability or their home conditions. So keeping schools open is important to protect and help the healthcare system as well. Dr. Elliman's research showed that closing schools did not decrease the number of community cases or hospitalizations. 30% of healthcare workers have students that are school age and can't access their jobs if they have to stay home. We currently have skyrocketing cases, and closing schools would just increase healthcare staff shortages. So I would encourage anyone who is watching today to read Dr. Branch Elliman's remarks. They were posted as an op-ed piece in the Washington Post last Thursday. I'm pleased to say that we were able to distribute rapid antigen tests to our faculty and staff before school resumed last Monday. We had an opportunity to receive those from the state. We're happy to know that we'll be getting more, and we've actually purchased more ourselves as well. So through the support of the state, prior to returning to classes on the 3rd, our district provided COVID tests to any interested staff. Again, also with the cooperation of our teachers union, we were able to distribute 830 COVID kits on Sunday the 2nd before school resumed, and about 40 of those staff members tested positive. So this proved to be a good measure on our part. So we're happy to keep to get ahead of that before they came to school. We've also been a part of the test and stay protocol this year. And while it's been very taxing on our health offices, it's also kept students in classes who would have otherwise been quarantined unnecessarily last year. So this test and stay program is a testing initiative that's intended for asymptomatic close contacts of individuals who have confirmed COVID-19. So the testing program allows anyone who's asymptomatic and close contact to remain in school if they receive an individual rapid antigen test each school day prior to start of the day and test negative, as well as following other guidelines, of course, masking and distancing. So individuals who are asymptomatic and fully vaccinated are exempt from the testing and quarantine response protocols. They simply continue to monitor for symptoms, wear a mask, and follow all the other guidelines that we have in schools. The Department of Education has extended its mask mandate for schools through February, which happens to align with their local mandate. I want to remind the public, though, that masks are just one of the protective layers that our schools are using to minimize the spread of COVID. We also continue to implement the test and stay, as I said, to closely monitor students and staff, while also reducing unnecessary quarantines. We collaborate with our local Department and Board of Health. We continue to utilize what are called MERV 13 filters. These are hospital grade filters in our HVAC units. We have inserted air purification devices in all of our units to maximize and also maximizing air intake to the extent possible to really circulate fresh air. Our older schools that don't have forced ventilation, we have purchased what's called a Valera Air and Surface Pro technology in every classroom, every instructional space, hallways, common spaces. And these devices are cleaning the air throughout the day and at night. So, you know, while COVID does not seem to be going away right now, I'm happy to report that our schools are open for in-person learning, and we're literally keeping thousands of students in school that would have been quarantined last year for 2 weeks unnecessarily, thanks to this test and stay program. So, you know, we're not through this yet, but I think that we're in a good place in terms of the measures that we're taking, and remain optimistic. So thank you, Donna.
Thank you, Christopher. And before we move on to Matt, I'd like to ask you one quick question about the test and stay, because I know that is something that parents could sign up for at the beginning of the school year. If parents have decided they would like to include their children in that, is there still an opportunity?
There always is. So this is, again, it's only for people who have not been vaccinated. And the reason being is what they found last year and this year is the close contacts in schools, a very short, small percentage of those actually test positive. So we've had a low positivity rate of all the test and stays from the vaccinated, from the students that are in school and close contacts. Because of all the mitigation strategies that we use, we can't guarantee the same situation for a close contact that happens outside of the home. So this is absolutely, it's available to for families to sign up for if the children have not been vaccinated. If they are vaccinated, as I said, we continue to monitor for symptoms, encourage them to stay home if they have symptoms and get tested, but it's always open for anyone who has not had their child vaccinated. Okay,
thank you so much. And for some, they're still not eligible. For most, very recently in the last couple of months, they are. So that's forward movement as well. I'd like to move on and go to Matt Muratori, our state representative for the 1st Plymouth District. Matt, there's been so much that's been happening on a state level over just the last couple of days. There's been so much information coming out. Would you like to give us some updates about what's happening?
Sure, Donna, thanks. Appreciate that. Yeah, so talk about testing that Dr. Campbell was talking about. The governor has just purchased 26 million rapid tests for the Commonwealth. The first batch will start coming in this week and will run through March, depending on the supply line that's available. So that was some good news. Additionally, for the healthcare system, An additional 500 National Guard troops are going to be deployed into healthcare facilities. That will include hospitals as well as long-term care facilities. There has been some testing changes that Dr. Potvin alluded to. And basically, for employers, you're not going to need, if you're not healthcare, you're not going to need to test somebody to come back. That's one of the changes that's going to happen. But there's a lot of common sense here that I think that we're trying to get out to people is that the symptoms are a fever, chills, cough, sore throat, headache, loss of taste, smell. If you have any of that, then you should be isolating. You should be staying home, for the required 5 days, whether you can get a test or not. We know it's difficult to get tests, but if you have any of those symptoms, you should just stay home and rest. Particularly if you've been vaccinated and have the boosters, there's the testing requirement. Are going to change somewhat because the booster and vaccinated people, it's proven that they've been it's working on them, and in a lot of cases it's just a bad cold or maybe a flu-like symptoms that they're getting. But they're those folks really aren't being hospitalized. The numbers that we are really trying to concentrate on now is not so much the average daily test of people that are getting COVID. Because those numbers aren't quite as accurate because those are only the reporting numbers. There's also people who are testing at home that aren't reporting that they're testing. So the numbers were most likely are a lot higher than that. But it's the hospitalizations that we need to look at. And what Dr. Poffin reported from the hospital is somewhat alarming that, close to half the population of the hospital has COVID. What's happening this week with hospitals now, they're going to start breaking down their numbers so that we can all see how many actually have come in with COVID and how many actually came in with something else and then had COVID. So there's going to be different ways they're going to report it. But when you start looking at the hospitalizations, we're almost at 3,000 folks in the hospital at this point, with about 65% of those folks that are hospitalized now in the Commonwealth are unvaccinated folks. So again, it does show that the vaccine and the boosters are working. When you look at percentages, as Dr. Campbell put percentages for the schools, when you look at percentages of those folks who have been vaccinated that are vaccinated people have been hospitalized. That's about 10%. 5.1% vaccinated people had confirmed infections in the Commonwealth. We have 2.4 million people have boosters, and we're doing 40,000 boosters a day now. 5.130 million people are vaccinated here in the Commonwealth as well. And the only last thing that came out, Donna, this week, and you and I had a brief email exchange on this is, and this is important for folks, the myvaxrecords.mass.gov is a site to go to, and it takes less than a minute. You can download your vaccination data. So if you've been fully vaccinated, and if you have a booster, you can actually download it. It's very simple. You're putting in your name, your date of birth, and your mobile phone number or email. And within a minute, you can have it on your phone, download it to your wallet in your phone, or however you want to take a screenshot of it, et cetera. That's going to be important because when you start going to places that are requiring a vaccination card, and places like Boston are now starting this weekend will require a vaccination card to get into restaurants and other venues. It'll be important to have it. So it's an easy way to get it. We all have the cardboard card, that we've been carrying around, and it gets a little torn and tattered and it may be lost, but the MIS system that the state has with everyone in Massachusetts is there. You can download. Again, it only takes a minute to do. So I think that would be important for people. And that's the update we have so far, Donna.
Thank you, Matt. And also just to add to the MyVax records, I was able to not only download my own, but also download my husband and my children's, and then share it with my husband. So we now both have everything on our phones. It literally took me less than 10 minutes to take care of it for all four of us. So it's very quick, it's very efficient, and it's essential. because as you said, those cards they have gotten a little worn over the last year or so. And it makes it super simple to have everything available and share it with schools, share it with doctors' offices, share it with employers, and any place we're going. So I encourage everybody who has been vaccinated to go to the website and make sure that they have all of their information easily accessible. So thank you so much, Matt. We'll have a couple of questions for you when we come back. But right now, I'd like to go back to Dr. Wilson. One of the things I'd like to ask you, Dr. Wilson, is, things I've heard, and I'm sure many people have heard over the last couple of years. What do you say to people who say that they have trouble believing guidelines because they're constantly being updated, or they have trouble believing results because they're constantly being updated? How do you help people or help to explain that phenomenon throughout this pandemic?
Well, first, this is an understandable concern, and it's one that I think most of us have asked ourselves from time to time. I think the key here is to remember that we are in a learning phase, and we're going to be in a learning phase for probably years to come with COVID. And so keeping in mind that the scientists who are discovering new insights, the policy people who are making new decisions based on those new insights, these are things that are happening on a real-time basis. And we have to accept that. It means that some decisions that are made today may not make sense tomorrow once new information and new insights come about. So I think, again, we have to, based on the evidence that we have so far, the scientists have ultimately been right. The vaccines that we have now clearly work. Other mitigation measures are very effective. We have to recognize that as the truth and accept it as such, even though it may be modified somewhat in the future. So trust in the science.
Excellent, thank you. Is there anything else you'd like to share with our audience today?
Just the observation that the school system seems to be doing an outstanding job, and it's really very reassuring to hear what was just reported. And yet at the same time, what's interesting is some of the decisions that have been made were based on the difficulty in finding tests. And so that may end up changing the approach that's taken. And also some of the history of how frequently infections appear may change as well, given that we're dealing with a totally different variant, which is much more transmissible, as we all know, but much less severe in general. And Matt's comment earlier as well, I think, is important to keep in mind, and that is we're underestimating, and we don't know how vastly, the number of new infections, the number of new cases, if you will, by not knowing how many infections were diagnosed at home through an over-the-counter test and never reported. So these are all things to keep in mind as we move forward.
And it's a constantly changing landscape, as you say. So it's something that we all just need to continue talking about and communicating and doing our best to work together to solve the problems, answer the questions, and keep ourselves safe and healthy. So thank you very much, Dr. Wilson. I'd like to move back to Dr. Potvin. Dr. Potvin, updates change frequently, as we were saying. And I know in today's Board of Health meeting, you're going to be talking specifically about masks and new recommendations and choices people can make in purchasing masks for themselves, for their family members, for their children. Where do you recommend people go to get reliable information, whether it be for statistics or even maybe perhaps what type of mask to buy?
Yeah, well, that's going to be obviously a major topic for this afternoon later on. But there are lots of information now. What's happened, again, speaking of things changing, is that these variants change everything. They change what should be done, how it should be done. It even changes the type of masks that should be worn. That really changed a lot because of the differences with the Omicron variant. The reason it changed with the Omicron variant is simply because it replicates much more rapidly in the upper respiratory tract than the previous variants did. And because of that, people may be harboring and probably are lots more viruses, which they can transmit to others by coughing, sneezing, or even just speaking or singing. So that's one of the things that makes it much more difficult to control. And that's one of the reasons we're seeing a constant spike in what's happening. In terms of the masks, just briefly, what they're now recommending, and this has recently come out from the CDC, there's also a website that I believe is called Project 95, which is actually a nonprofit group that evaluates masks and makes recommendations and actually sells the masks at no profit to anyone who might order through their website. So that is also quite a rich source of information for those that wish to purchase masks. But what they seem to be recommending now is that the cloth masks are not as effective as they were against the previous variants. The surgical masks sort of come in second, and some people say the reason why they're not totally effective against the Omicron variant is because they don't fit firmly enough around the sides of the face. To get something that does that, you need the N95 mask, which used to be reserved strictly for healthcare workers, but now is more widely available. And there are a couple of others called KN95 and I think KH or KF94 that are evaluated by the FDA. So the FDA does evaluate some of them. They fit more comfortably and they fit more firmly around your face. There's a little metal device that goes over the bridge of your nose and prevents your exhale breath from going up and towards the top of the mask and out. So again, there's a lot of evolving sort of information and advisement about this. And I'll certainly be talking about that along with the rest of the Board of Health members later on today.
So Dr. Potvin, thank you again for your information, for being here today, and for your service to the town. It's so appreciated, and it's an amazing amount of work you've all been doing over the last 2 years. So thank you very much. We appreciate you. I'd like to move back to Representative Muratori. Mathew, there's also some additional information that's been coming out this week. I'd like you to talk to very quickly, just to remind employers that there are options for them to be able to apply for potential reimbursement or funding for sick time as a result of COVID. And also there's news that's just come out from the federal government that over this weekend, it's going to be possible for people to either get reimbursement or paid directly through their health insurance companies to be able to get at-home testing.
Yeah, that's right, John. The latter is still being developed at this point for the federal government. With regard to the state, and people who are out because of COVID, the 5 days, are able to get the paid family medical leave through the state, and then the employer is able to get reimbursement for that. And there's a process that they need to go through to do that. It's not that difficult of a process, but you work with your payroll company to get that into the state, and all the payroll companies are aware of that. So if you're not aware of it as an employer, whether you're small or medium or large, you should be, because you can get reimbursed for that.
Excellent. Any additional comments you'd like to add, Matt?
No, I just think it's it's with regard to the testing of people, and I've said this before, Donna, and you've heard me say this many times. I think in the Asian culture, when you're not feeling well and you're out and about, you wear a mask because it's a sign of respect. You don't want to get others sick. And I think, and I'm hoping after 2 years of this, some of this is gonna rub off of us here in the States, where whether we have the flu or a cold or something, that we decide to wear a mask because we're not feeling well. And whether it's the symptoms are all the same, whether it's a cold, whether it's COVID, whether it's a flu, we should all be thinking that way. And I hope that that's something positive that will come out of this whenever we go from a pandemic to an endemic. But I think we'll just need to keep that in mind.
Thank you. I appreciate that. And to all of our guests and panelists today, thank you so much for your time and your participation. It's a constantly changing environment, but as you said, Matt, there are some basics, that have been, and that all of you have referred to, that are been pretty consistent throughout these 2 years. If you'd like to, if you only caught a part of this, or if you'd like to find out more information to see this episode again, please visit packtv.org and just click on the watch button. You'll be able to find all the ways that you can watch this program. And if you have any questions, you can also send them in to plymouthinfo@packtv.org, because we will be holding future episodes, an average of once a month right now at this point. If you're looking for more information for guidelines, for testing, for local information, for numbers across the Commonwealth, there are 2 sites you can go to: cdc.gov for general information federally, and for information across the Commonwealth, please go to mass.gov/COVID. And again, if you would like to get a copy of your digital vaccine card, myvaxrecords.mass.gov. I am Donna Rodriguez. For myself, everybody here at PACTV, and all of our panelists, thank you for joining us today, and stay healthy.